Never underestimate a so-called mini-stroke, because it's not as small as you might think. Did you know that 1 in 3 people who experience a mini-stroke will suffer a major stroke shortly after? And the frightening part is that most people don't even realize they just received that warning. Seemingly harmless signs like temporary numbness in the limbs, slurred speech for a few minutes, or blurred vision for a short while. All of these can be the final warning shot your brain sends before a real, life-threatening stroke occurs. The truth is, 80% of strokes can be prevented if you recognize these warning signs and act in time. Sadly, every year, over 240,000 Americans experience these mini-strokes but ignore them, and only when it's too late do they realize the price they have to pay. In today's video, I will show you how to recognize those silent warning signals so you don't become the next tragic number in these heartbreaking statistics. So what exactly is a mini-stroke? Medically, it is called a transient ischemic attack, or TIA for short. The word transient means temporary, and ischemic refers to a lack of blood flow. Therefore, a TIA is a temporary disruption in the blood supply to a specific part of the brain. Imagine it as a temporary blockage in a vital pipeline. This blockage is often a small blood clot that briefly obstructs an artery, or it may be significant narrowing of an artery that restricts blood flow. Unlike a major stroke, where the blockage persists and causes permanent brain cell death, in a TIA, the obstruction lasts only a short time. The blood clot may dissolve on its own, or the body may quickly reroute the blood flow. As a result, the symptoms of a TIA are also temporary, typically lasting from a few minutes to, by definition, less than 24 hours, after which the person often feels completely normal again. But here's the critical point to remember. Temporary does not mean harmless. A TIA is not a trivial glitch. It is a powerful, urgent warning from your body. It's like a fire drill before a real, devastating fire. It signals that there is an underlying problem, perhaps a tendency to form blood clots or significant plaque buildup in your arteries, both of which place you at a dramatically higher risk of suffering a full-blown, potentially irreversible stroke. In fact, the risk of a major stroke is highest within the first few days and weeks following a TIA. That's why recognizing these warning signs and seeking immediate medical evaluation is absolutely crucial. Today, we will analyze the 10 key signs and characteristics of a mini-stroke. Some of these signs are fairly common, while others are more subtle and easily overlooked, especially among people aged 60 to 80, where certain changes are often mistakenly attributed to simply getting older. Understanding these signs can help you take decisive action. Let's get started. The first 2 points we'll cover are not specific symptoms, but rather the nature of TIA warnings, characteristics that often lead to dangerous delays in seeking help. 1. Symptoms appear suddenly and then disappear. But don't let that fool you. One of the most dangerous characteristics of a transient ischemic attack, TIA, is its fleeting nature, which often causes people to underestimate it. It all begins very suddenly. 1 minute you feel perfectly fine, and the next, you experience numbness in your hand, weakness in your leg, slurred speech, blurred vision, or dizziness for no apparent reason. The real danger lies in the fact that just a few minutes later, or at most within 1 to 2 hours, all the symptoms completely vanish, as if nothing ever happened. Many people breathe a sigh of relief, thinking it was just a minor issue, nothing to worry about. Unfortunately, that temporary recovery does not mean you are safe. On the contrary, it is a serious warning from your brain that something is wrong with your blood vessels and a full-blown stroke could strike at any moment. The most important message is this: never ignore symptoms, even if they only last for a short time. That brief episode could be your final opportunity to intervene and prevent a severe, life-threatening stroke that could rob you of your life or your mobility. take action before a major, potentially irreversible stroke occurs. 2. Symptoms are easily mistaken for other issues, such as aging, stress, or fatigue. Many TIA symptoms can resemble, or be easily mistaken for, common health problems or sensations that, unfortunately, are often dismissed as simply part of getting older. For example, sudden dizziness might be blamed on mild dehydration, mild confusion, or brief forgetfulness. Oh, just a senior moment. Unusual fatigue? I didn't sleep well last night. The key factor that distinguishes a TIA is often the sudden and unusual onset of the symptom compared to your usual state of health. If something clearly feels off and unfamiliar, do not automatically dismiss it. It needs to be discussed with your doctor, or if it is severe and sudden, call emergency services immediately. Now, let's dive into the more specific symptoms. Remember, any of the following, especially if they occur suddenly, could be a sign of a TIA. 3. Sudden difficulty, speaking or slurred, unclear speech, aphasia, dysarthria. This is a classic warning sign of both stroke and TIA. The language centers in your brain require a constant supply of oxygen-rich blood to function properly. If that blood supply is temporarily interrupted during a TIA, your ability to communicate can be affected immediately. You may experience aphasia, which means difficulty finding the right words, using incorrect words, or struggling to form coherent sentences, or difficulty understanding what others are saying. Another form is dysarthria, where your speech becomes slurred, slow, or mumbled. The key factor is the sudden onset of these symptoms. 4. Sudden confusion or difficulty, understanding speech. This warning sign relates more broadly to cognitive function. You may suddenly feel like you're trapped in a mental fog, unable to think clearly. Familiar surroundings may suddenly feel unfamiliar, or you may struggle to recognize people you know well. This type of acute confusion, sometimes referred to by doctors as delirium, occurs when blood flow to the frontal and temporal lobes of the brain is disrupted. Confusion related to a TIA is a sudden, alarming change compared to your usual mental state. 5. Sudden weakness or numbness, often on one side of the body. This is a hallmark feature of both stroke and TIA. Sudden weakness or numbness, almost always affecting one side of the body. This may involve the face, an arm, or a leg. The motor cortex in your brain controls muscle movement. If blood flow to one side of the motor cortex is interrupted, the opposite side of your body will be affected. You might suddenly notice one side of your face drooping when you smile, or an arm that suddenly feels heavy and weak. This one-sided pattern is a very strong indicator of a neurological event like TIA or stroke. 6. Sudden dizziness or loss of balance, abrupt onset. This is not just a mild feeling of lightheadedness. It's a sudden and often intense sensation. You may experience true vertigo, the feeling that you or the room around you is spinning violently, or you may suddenly lose your balance and fall, or find yourself unable to walk in a straight line, a condition known as gait ataxia. The cerebellum and brainstem play a critical role in coordinating movement and maintaining balance. If a TIA disrupts blood flow to these areas, your entire sense of balance can be thrown into chaos, a particularly dangerous situation that increases the risk of falls, especially in older adults. 7. Sudden temporary vision changes. This can present in several different ways. You may suddenly experience blurred vision or double vision, diplopia. One particularly alarming symptom is transient monocular vision loss, amaurosis fugax, often described as a dark curtain slowly descending over your field of vision. Others may experience partial vision loss in both eyes, homonymous hemianopia, or see flashing lights or shimmering spots, scintillating scotoma. These visual disturbances occur because the occipital lobe, the brain's visual processing center, is not receiving adequate blood flow. 8. Sudden severe headache, often described as the worst headache of my life. This is the kind of headache you should never ignore. A sudden, severe, and extremely painful headache, striking like a bolt of lightning. It is often described by patients as the worst headache of my life, reaching peak intensity within just seconds or a minute. Vascular stress during a TIA can trigger what is known as a sentinel headache, serving as an early warning of a potential underlying danger. 9. Sudden tingling or pins and needles. Sensation, paresthesia, often on one side. The medical term for this condition is paresthesia. It occurs due to a temporary reduction in blood flow to the somatosensory cortex in the brain. Like other TIA symptoms, it is often unilateral, affecting one side of your body, typically the face, arm, or leg. You may feel the sensation starting at your fingertips and spreading up your arm, or beginning in your toes and moving upward. 10. Brief loss of consciousness or lightheadedness, presyncope. This can be very frightening, a sudden brief loss of consciousness or a sensation of lightheadedness, as though you are about to faint. In medical terms, this is called a presyncopal episode if you do not completely lose consciousness, or syncope if you actually faint. Loss of consciousness or presyncope related to a TIA occurs when blood flow to the reticular activating system in the brainstem is temporarily disrupted. These episodes may only last a few seconds, but they are a highly significant warning sign. To quickly summarize, here are the 10 key signs and characteristics. Symptoms that appear suddenly and then disappear. Symptoms easily mistaken for other conditions. Sudden difficulty speaking or understanding speech. Sudden confusion. Sudden weakness or numbness on one side. Sudden dizziness or loss of balance. Sudden temporary vision changes. Sudden severe headache. Sudden tingling or pins and needles sensation. Brief loss of consciousness or lightheadedness. If you witness any of these signs in yourself or someone else, remember the acronym FAST. F is for face drooping. Ask the person to smile. Does one side of the face droop? A is for arm weakness. Ask the person to raise both arms. Does one arm drift downward? S is for speech difficulty. Ask the person to repeat a simple sentence. Is their speech slurred or strange? T is for time to call 911 or your local emergency number. If you observe any of these signs, call emergency services immediately. Every second counts. Brain cells die rapidly during a stroke, so the sooner the patient receives medical care, the greater their chance of recovery and minimizing long-term disability. Time is brain. Do not wait to see if the symptoms resolve on their own. Do not attempt to drive yourself or the patient to the hospital. Call emergency services. They can begin life-saving evaluation and treatment on the way to the hospital. Although we've focused on the warning signs, it's also worth briefly mentioning the common risk factors for TIA and stroke, especially among people aged 60 to 80. These include high blood pressure, diabetes, smoking, high cholesterol, atrial fibrillation, a type of irregular heartbeat, a history of previous TIA or stroke, and a family history of stroke. Managing these risk factors is key to prevention. Recognizing a TIA is the first, most crucial step in preventing a major stroke. These 10 signs and characteristics are your body's, or your loved one's, emergency alarm bell. Listen to it. For those of us in our 60s, 70s, and 80s, being proactive about health and staying alert to these warning signs is not about living in fear. It's about empowerment. It's about taking control and giving yourself the best possible chance for a long, healthy, independent life. If you found the information in this video helpful, please share it with your friends and family, especially those who are in high-risk age groups or are caring for parents or grandparents. This knowledge could help save someone's life, maybe even someone you love. Don't forget to click the like button as it helps more people access this vital information. And to make sure you never miss future videos about heart health, stroke prevention, and other important medical topics, please subscribe to the channel and turn on the notification bell. We also warmly welcome your feedback, questions, or even your own personal experiences in the comments section below. Your story could inspire or provide a valuable lesson for our entire community. Thank you for taking the time to watch. Stay alert, stay informed, and take proactive steps to protect your health and the health of your loved ones. See you in the next video.